So this is just going to be kind of an overview of the cranial nerves and the foramen of the skull where the cranial nerves kind of pass through. I'm just kind of doing this kind of for my own good, just so I kind of get the concept a bit down, and just thought I'd share it as well. So this first part that we'll be looking at, it's called the Cribriform Plate, and it's kind of this little thing right here, and you can kind of see little finger-like projections going through, and those are part of the olfactory nerve. So that's the first cranial nerve number 1. And then the next foramen that we'll be looking at is this right here. It's called the Optic Canal. And then through this, as we can see, is the optic nerve that travels through that. And not only does the optic nerve travel through it, but so does the ophthalmic artery. I can probably real quick try to find that going through. So we're here probably. Let's see. There you go. Ophthalmic artery. Turn those off so we can see a bit more. So that's all that's going through the optic canal. And then the next little foramen thing that we'll be looking at is the one just beneath it. And as you can kind of see, if I can zoom in a little bit, it goes to the back of the eyeball here. So eyeball, there you go. So the whole thing is called the superior orbital fissure. And through this one travels all the nerves that go to the eye. So everything that makes sense that goes to the eye. So you have the ocular motor cranial nerve, you have the trochlear cranial nerve, and you have the abducens cranial nerve. And you also have V1, which is the ophthalmic division of the trigeminal nerve. So I'll see if I can find all these real quick. So there's the ocular motor, so that's cranial nerve number 3. This might be, which one is this? This is the trochlea, the abducens, and then there should be V1, the ophthalmic nerve, which is part of the trigeminal nerve here. It's a super big one. So then after the superior orbital fissure, we have this next little hole here, which is called the foramen rotundum. And then through this one is the other part of the trigeminal nerve, which is the maxillary nerve, which is V2. And as we can see on this little side here, whoops. So it's right down there, and it's right here. So that is the foramen rotundum. And then we have another foramen here called foramen oval, however you want to say it. The other part of the trigeminal nerve passes through here. It's the V3, and it's the mandibular nerve. So that's all the 3 parts of the trigeminal nerve. So it goes trigeminal nerve, it goes to the trigeminal ganglion, and then it differentiates in between V3, which is the mandibular nerve, V2, which is the maxillary nerve, and then V1 is the ophthalmic nerve. You can clearly see each of the foramen they go through. So once again, I get to recap. V1 goes through the superior orbital fissure. V2 goes through the foramen rotundum, and V3, I said V2, yeah, I'm not sure if I said the numbers backwards, and then V3 goes through the foramen ovale. So that's all the trigeminal, so that's all of cranial nerve number 5. And then we have another foramen here. None of the cranial nerves pass through it, so I'm not really going to pay attention to it. But it's called the foramen lacerum, I want to say. But I'm just going to kind of ignore that one for now. And the other foramen, as you can probably see, is a little tiny hole here. It's more lateral to the ovale. And that one is called the foramen spinosum. And the thing that passes through that is the middle meningeal artery. So if I turn the arteries on and click this guy, there you go. Middle meningeal artery passes through that foramen right there, which is the foramen spinosum. Turn these guys off again. There we go. I guess I should probably briefly cap as well. If you follow this border here, this is part of like the sphenoid bone. This is the whole anterior portion here. So yeah, like if you follow this little curvature here and here, that's all part of the anterior. This whole area, if I follow this ridge here, this big circle, kind of on the cursor. That's the whole middle portion, middle foramen. And then this whole other chunk here is the posterior foramen. Alright, so then if we look at the foramen of the posterior aspect of the skull, we have, let's see, where here is probably the first one we want to look at. This is the internal auditory meatus, and through this we'll be traveling. So I guess, yeah, if you think about it, we left off at cranial nerve number 5, and we actually got 6, which is the abducens, which passes through, so I can zoom in here, through that superior orbital fissure. So we're up to 6, and the next cranial nerve is 7, which then passes through this internal auditory meatus. So if I click on one of these, should be facial. There you go. So facial is cranial nerve number 7. And then you also have the vestibulocochlear nerve, which is cranial nerve number 8, that passes through that that canal. So right here, that's what we're looking at. So that's that one. And then, so since we have 7 and 8 cranial nerves, now we have 9, 10, and 11, and they all pass through the jugular foramen, which is this kind of larger hole here. So this one we should have, which one is that? So we have glossal pharyngeal, which is cranial nerve number 9. And we also have the vagus nerve, which is cranial nerve number 10. And then both of these here, click on it, there you go, those are both accessory nerves. This is probably like the cranial portion of it, and that's probably the spinal portion of it, because it goes down quite far, and down that way. And then those all go, yeah, once again, those all go through the jugular foramen. And if I also turn on Venus real quick, if I click down there, so there, yeah, there's the internal jugular vein that passes through this foramen here. Turn that off. And then what else we have? So we also have, so we did accessory nerve, which is cranial nerve. Whoops, cranial nerve number 11, and then the last cranial nerve we had to go over is the hypoglossal nerve, which travels through the hypoglossal canal, which is straight down there. This little hole. So if I can look at the other side. Oh. So this hole right here is the hypoglossal canal, and that's where the hypoglossal nerve comes through. So pretty easy. And then I guess the last like giant foramen we need to look at is the foramen magnum, which is this giant hole in the bottom of the skull, and that just passes through your whole spinal cord, your meninges, and all that CSF fluid. So this whole hole down here is the foramen magnum. And that's basically it. That's like a kind of a quick review of all the cranial nerves and the foramen that they pass through. Hope you enjoyed. Peace.